Among one of the big topics you'll start to hear about over the next several weeks, especially from your primary care provider, is the seasonal flu. The flu season is upon us in Greater West Bloomfield as we get into the fall and head toward the winter. And so there's a lot of questions about how dangerous is the seasonal flu? What does the flu shot do for me every single year? Do I need it every single year? And of course, like anything else, there's tons of information out there, which means there's also a ton of noise out and about on this topic. Here to clear up some of that noise and get to the answers on some of these questions is Dr. Jamie Taweel, medicine specialist at Grand River Medical Associates. Dr. Taweel, thank you for being with us today.
Thank you for having me as always. How are we doing?
Doing well so far. A good start to the week and hoping it's much the same for you.
Yeah, definitely. Definitely good.
So as we get into this week, we're in the first week of fall, Dr. Taweel, and that means we're getting into flu season. And as we get into the flu season, there's so many different misconceptions about the true risks and consequences of the seasonal flu. It's something that we deal with every single year. It looks the same every single year, but it can have a variety of different impacts. So what are the risks and the consequences of contracting the seasonal flu potentially for individuals across the board?
Well, I mean, the risks of flu remain the same as always. If you're a patient that's going to have some comorbidities, but in addition to people that don't have comorbidities, the flu can definitely impact you. It can cause respiratory issues. It can cause, severe, inflammatory reactions that could be dangerous. Many people are hospitalized, and unfortunately, flu does cause deaths. You want to basically try to reduce your risk as much as possible, and the best way to do that is to get the flu vaccine.
And on that note, there is some contrary to that. There is some contrarian information about the flu vaccine. So many say, well, we see this every single year. People get the flu one year. It helps to protect them from the flu the next year. Those small changes that happen year to year, those mutations we've heard so much about with COVID-19 that also happen with the flu. Maybe those aren't as severe as they're made out to be. But so on that note, let's just start with the basics. What does the flu vaccine do to protect people on a year-to-year basis? And why is it something that people are suggested to get year in and year out?
So the flu vaccine is basically proteins from the flu virus. The CDC and the powers that be basically try to determine what the flu is that's going to sweep through the country. And they make an educated guess based on what they find, and they create a vaccine based on that. And what they do is they submit that vaccine to everybody to get a flu vaccine. Sometimes they're good hits and they definitely protect you from the flu. Unfortunately, some years they do miss and different strains blow through. The vaccine is very specific to one type of flu, although mutations you can get coverage for specific mutations. So every year there's a different vaccine for a different flu. And the hope is that it will definitely reduce your risk of getting the flu. And not only that, but reduce your risk of getting a severe case of the flu so that you're not being hospitalized or you're not dealing with, significant respiratory or otherwise dangerous problems that could impact you.
And on that note, you mentioned the way that the flu vaccine is determined by the powers that be at the Centers for Disease Control and Prevention at the World Health Organization and others in the U.S. and around the world that ultimately output these vaccines country by country and region by region. So you mentioned within that there are chances that the flu strain that they predict is going to be the predominant strain may not actually be the case and may end up being a near miss in some case in terms of the vaccines. But those vaccines that you take can still have some impact in preventing some of those severe symptoms. But with that, you also have those misconceptions around the flu vaccine not being accurate or not being necessary every single year. So what is your reaction to that, or what's your rebuttal, better yet, to that as a medical professional, knowing what you know about the validity of these flu vaccines and the way that they actually can help people on a year-to-year basis?
So medicine is not an exact science. It tries to get exact as possible. And it's very difficult when, I've used this example before, but you're basically trying to repair a car as it's driving down the road. So to predict which strain is going to be the predominant strain in real time can sometimes be difficult. Now, they've done pretty well historically, and they've had some pretty good predictions, and they usually do well. And the flu vaccine definitely reduces your risk. Not to mention the fact that, it can it can address and help with mutations. As we've seen with COVID, we had a COVID vaccine that definitely helped with certain strains of COVID, not all of them, and there were some misses as well. But for the most part, it was a really good opportunity to get on top of things before they became significant problems. So, my rebuttal is that anything that's going to offer you a better chance of being healthier in the long run, I don't understand why that's something you shouldn't at least take a very good look at. I always encourage patients to get the flu vaccine. I always will. I always receive the flu vaccine. I give my parents the flu vaccine. However, I understand that there are some concerns, but the best I can do is educate people.
Joined by Dr. Jamie Taweel from Grand River Medical Associates on today's edition of the Splash Live. You can get in contact with Dr. Taweel and company at Grand River Medical Associates by visiting their website, grandrivermedical.com, or calling them 248-264-6169, 264-6169 for more information. So often, Dr. Taweel, when we get to the flu season and we start hearing all this about encouraging us to get the flu shot, people's immediate reaction is often, well, I don't want to have the side effects of getting the flu shot. Every time I get the flu, it makes me feel like I've had the flu, and I get that pain in my arm for a couple of days after getting the flu shot. So in terms of the side effects, what side effects should be expected with the year-to-year flu shot, and what are those other ones that may pop up and not necessarily be severe, but be uncomfortable for a short-term period?
So let me first start by saying the misconception that people often say, well, the flu vaccine gave me the flu. And that's unfortunately, fortunately, that's just not the case. You're taking a protein that makes your body recognize the flu virus when it is exposed to it. And it's basically like gearing up for, battle. And so your body is going to have those types of reaction. To be expected, local site reaction at the site of injection. Your body's going to react to that. You might have some soreness in the arm for a few days. And then your body is going to mount an immune response to the flu virus as it is received from the vaccine. So you are going to feel possibly a little bit lethargic. You might have a low grade temp. You might feel sluggish. You might feel a little bit achy, but that's very, very minimal compared to what you would expect if you were to actually get the flu virus. So I take, 1 to 2 days of listlessness as opposed to, a week of absolute misery. Now, I know I'm exaggerating a touch, but I will say it is a very small reaction compared to what you would have otherwise expected should you receive the flu. So I do think it is a very beneficial thing. Things that are unusual would be a anaphylactic reaction, and those are typically due to the proteins that the flu virus is made from. And it's kind of like saying, I'm allergic to pizza, when in reality you're just allergic to the particular cheese that the pizza is using. You're not allergic to the vaccine, but more so the proteins in which the vaccine is produced, stored, as well as preservatives, et cetera. So those are things to definitely consider. However, in response to that, they do make different types of vaccines with different proteins and preservatives that may make it a little bit easier for people. However, I do understand the concern, and no one wants to have an anaphylactic reaction. So any type of severe reaction needs to be reported immediately to your physician, as well as that needs to be documented in your chart so that you don't run the risk of having that again.
Dr. Jamie Taweel joins us on The Splash Live on Civic Center TV and 89.3 Lakes FM. Your stories from your hometown on your community media outlets. We're talking about the seasonal flu and in particular the flu vaccine that comes out each and every year. And Dr. Taweel, to go back to discussing just influenza in general, it's been something that we've been afflicted with in our communities and our society for decades, for hundreds of years at this point. It's gone through a number of different mutations. We've had millions upon millions of people who have contracted it over the years and survived it, which of course helps with our body's reactions if we do contract the flu. But it's not hyperbole to say that every single year, a significant number of people, including children, do die as a result of contracting influenza. So speak to that particular existence. When someone does contract the flu, what do they often feel? And who is most at risk for those symptoms with the flu turning into severe outcomes that could potentially be deadly?
So I like to compare it like this. If people get a sinus infection or a throat infection, they typically have problems at the area of infection, or a bacterial infection. A flu virus is a whole body thing. People feel miserable from head to toe. They feel achy, they have difficulty breathing. Sometimes they get GI upset, they get fevers, they're exhausted. And it is just, you feel like you got hit by a truck to use a silly example, but it is people are just miserable. People that are very, very at risk are people that have multiple comorbidities, lung issues, people with COPD, people with heart conditions. That can definitely make a for a worse scenario. People survive the flu all the time, and that is wonderful. We're glad that people are able to do that. But if you're the one, the small amount of percentage that have issues, that could definitely make this a more severe problem, and then stack that on top of other problems, it can become pretty dangerous. And when you have children, mainly children who that don't have complete development of their lungs yet, that children with childhood asthma, you don't want them to have something that could definitely be a long-term problem. You don't want lung damage early in life when your lungs are still developing, for lack of a better, to a degree, and just have that carry on to now you're an adult with respiratory issues. So anything we can do to reduce that is obviously going to be the safe bet.
More information can be found by getting in contact with Dr. Taweel and the friendly people at Grand River Medical Associates. GrandRiverMedical.com, or give them a call, 248 264 6169. 248 264 6169 for more information. And as we get into flu season, people want to make sure they're getting the flu vaccine at the right time to best protect them from influenza when it pops up during the season. What is the best time to get a flu vaccine, Dr. Taweel?
First, the best time is as soon as possible. The second best time is right now. So, late September, early October is when these things start coming around. Once the flu vaccine is available, the minute it becomes available, this is the best time to do it. Once you get it, you're good for the rest of the year. So earlier, the better. Once the school season starts and kids start intermingling, that's when things start to spread a little bit quicker and easier. Kids are bringing things home to their parents. So once the school season starts and flu vaccines do become available in September, probably the best time to get that taken care of.
And Dr. Taweel, on top of getting the flu vaccine, of course, we've learned so many of these measures over the last several years with COVID-19, but there's plenty of other steps that people can take to help prevent the spread of influenza during this season, both whether they're in school, their kids are in school, or even at home and around the community.
So you're looking for alternate things that can be done to help mitigate the flu?
Yes.
Absolutely. The best thing to do is to, maintain good health is always going to be my number one recommendation. Try to make sure that you have no comorbid conditions that make you the healthiest you can possibly be to ward off infections. However, as we've learned through COVID, contact precautions is always going to be. Flu virus is a respiratory borne thing. So try to maintain social distancing. I hate that word because that word really inspires a lot of fear in people. But, just to basically wash your hands, make sure that you're not coughing on people, make sure you're using appropriate protection, coughing into your hands, washing your hands immediately after, and keeping an eye on symptoms as they arise. If you start to get symptoms of flu virus, usually starts as a sore throat, small low-grade fever that can develop into a higher fever. If that happens, you want to just try to stay away from the general population as best as possible, isolate and talk to your doctor to make sure that you do have something that can be easily taken care of. And of course, getting the flu, there are antivirals that you can take for the flu, such as Tamiflu and things like that. Getting that on board as soon as possible is key, because the longer you wait, the less effective the medication is. So if you feel that you might be having the flu, even if you've received the flu vaccine, you may want to contact your doctor and get tested so that this can be treated as soon as possible and you can have good outcomes.
Other great resource for more information on the seasonal flu is cdc.gov/flu. Dr. Taweel, thank you so much for joining us.
Thank you so much for having me, as always, and it's been my pleasure.